Okay, welcome back.
Yep, welcome back. And you're still watching Morning Rush here on Metro Television with me, That's what the Crocodile. So that's the Starboy and Nanaya Tanobachi and YTV. Yeah. So we're getting into a conversation about herbal medicine. I think that on the show we've been talking about it for a while.
Yeah.
A lot of things that people think about herbal medicine, how it's going to be. How effective it is, if you can take that alongside, orthodox medicine, and even the diseases it can cure.
That's very important.
Because when you walk around town, there are lots of them.
One medicine
Can cure a lot of things.
Like
Sisimudin, Ayemtuo, Sasabro. There's a BBAB, and sometimes it's very dangerous when we have all of these things happening. When you walk along circle connection, you'd have a lot of that there. So we're going to be speaking to Dr. Prince OSEI on how we can effectively use herbal medicine, I beg your pardon, to sort a few things out in our body and all of that. Yeah, Dr. Prince OSEI, good morning if you're on there.
Yeah, good morning, David.
Great, good to have you on here. I hope you're fine.
Oh, Manaya, yeah, good morning.
I trust you're doing well this morning.
Yeah, my God grace, I'm very well. I hope you two are doing well.
We're good. We're great. Yeah. Now, let's get into our conversation. The other time we're talking about regulation and all of that, but this one I want to continue with the effectiveness of, these herbal medicine that we take, right? So, when one has a sickness, let's use malaria, right?
Yeah.
How effective is the herbal medicine that the person takes to be able to clear out the malaria? How should the person take the doses so that it could be effective? Sometimes people take the bottle and do and it is gone. They say it has flushed out the sickness and all that. Just share with us how we can take that to have effective usage of the drugs in our system.
Yeah. Yes, Betty, thank you very much. It's so wonderful how people perceive herbal medicine, like how as you mentioned, some people just take a bottle and take everything in and all that, causing all sort of effects and all that. And for the effectiveness of herbal medicine is as effective as the orthodox medicine for conditions that herbal medicines are known for. Last time I mentioned that there are integrated centers within the Ghana Health Service that uses herbal medicine services. And as part of the integration, there is a policy that talks about the medicines to use, how to take it and all that. And there is this essential medicine list. That is what talks about the medicines, yeah. And if you look at malaria, as you cited as an example, there are certain criteria that you have to look for. If you want herbal medicine that can effectively treat malaria, we have certain criteria that you have to look for. We have the cryptolepis containing anti-malaria. Just like if you know the orthodox medicines, when it comes to malaria, as you mentioned, we used to have the chloroquine derivatives some time ago. We changed to amodiaquine and all those, and now the gold standard for malaria treatment for orthodox medicine is the artemether-lumefantrine combination. The same applies to herbal medicine. So we have a couple of ingredients that should be found in the herbal medicine that you are taking for malaria treatment. So we have the cryptolepis containing anti-malaria herbal medicines. We have the morinda containing anti-malaria herbal medicines and so on. So if you are looking for any herbal medicine to be able to effectively treat malaria, these compounds have been found in herbal medicines to be effectively treat the malaria parasite. And at Insawam and other integrated centers too, we do some research. As I always say, herbal medicine is a new thing. So day in, day out, there are researches that goes on in the treatment of herbal medicine. And we have people who tested positive for malaria parasites. We do the blood film for malaria parasite, count the number of malaria parasites in there, and after treating with herbal medicine for about 5 days, they will go back to do, and you see that all the malaria parasites, if not all, majority of them has cleared from the body. showing that the herbal medicines are able to bring down the malaria parasite. It's so for other forms of infections, UTI and other things too. We do the culture, find out the active ingredient or find out the organism causing the infections and give herbal medicines. And later on, when we repeat the test, you see that the infections that was there is no more, meaning that herbal medicines really work. But it has to do with where you are getting the herbal medicine. Every day I sound that caution that wherever you are taking herbal medicine is very crucial, because that can cause some effect in your body if not taken well, if you don't take it in the right dosage as prescribed. Even now we have people coming to the hospital and you tell them to go through the dosages and they will still prefer to go the old way. But now the herbal medicines that we have on the market, most of them are standardized, gone through FDA registration and all that. So the dosages on the herbal medicine should be adhered to, and you get the effectiveness that you need.
A lot of us also do home remedy when it comes to herbal medicine, right? Does it apply to what you're saying also?
So for the home remedy, if you are taking anything in which can change the chemical nature of your system, it means you don't have to self-medicate yourself. The same way we don't advise people to self-medicate on orthodox medicine. The same thing applies to herbal medicine. Just that for herbal medicines, they are readily available, making it so exposed for people to just walk to their backyard and plug some and take. But if you do that and you have any complication, I'm not sure you have to blame the herbal medicine. It's just that you didn't know how to apply it in an effective way. So the last time we talked, I mentioned that the problem of herbal medicine is not about the medicine itself. It's about the practitioner or whoever is giving the medicine to you. So if you self-medicate and you have an issue, that is basically on you. You can't blame that on herbal medicine. And if you go to a professional or if you go to a practitioner and the practitioner advises you to take it in a certain way and you don't take it as it should, then that's is an issue that you have to deal with. So when it comes to the effectiveness and all that, that is what I can say about it.
Okay, Doc, earlier on when you were making your submission, you were stating that certain medications that used to be used to cure malaria has eventually upgraded, and you took us through the following steps. As human beings too, when you are exposed to one particular orthodox medicine, your body becomes so accustomed to it that sometimes when you use it, you even have to change that particular malaria drug you are using. And so I'm asking that the medical, the herbal medicines that people use in substitute to the orthodox, do their body at a time get used to one particular herbal medicine that they have to change or upgrade? You get what I'm saying?
Yes, that's an interesting question, Anna. When it comes to the treatment of infections, which malaria is part. Malaria is an infection, but it's a parasitic infection. So an infection is there when an organism invades the body and causes sickness in your body. So when it comes to infection in general, there is that resistance. There is this antimicrobial resistance that the medical world is trying to fight and all that. And it will interest you that herbal medicine is now or is being researched as the gold standard when it comes to antimicrobial resistance in medicine as a whole, not just herbal medicine industry. When for the orthodox medicine, the mechanism of action mostly is one way. So if it's blocking a receptor, if the medicine is blocking a receptor, if the medicine is working in a particular way, it works in that particular way. But but when it comes to herbal medicine, the mechanism of action changes based on the individual. So the issue of resistance is very minimal when it comes to herbal medicine. Let's take this malaria example that I mentioned earlier with the cryptolepis that I mentioned. If we use a place like the Center for Plant Medicine Research that have been using the cryptolepis since the center is more than 50 years. And they've been using this particular anti-malaria medicine called the Nibima, and it's basically Cryptolepis in tree. So if people that have been on that medicine since that time get their results when it comes to malaria treatment. So the medicine is able to fight the malaria parasite. And even till now, it hasn't been changed. It is still the same Nibima that is being given to patients, and they still get the effect as it was. But let's take the orthodox counterpart. We started with chloroquine. It has been changed to amodiaquine. It was changed to so many things, and now we have the artemether-lumefantrine. So it means that when it comes to treatment of infections, resistance to herbal medicine is quite better, or the herbal medicine is able to fight the infections better without you having to change the components and all that when you compare it with the orthodox medicine. The same with typhoid fever. At Insawam, one of the success stories or one of the conditions that we best treat is typhoid fever. And you know, with the orthodox medicine, the medicines that they've been given, people take it and will still be experiencing the symptoms of the typhoid, or sometimes you go back to check and it's still positive because of the antimicrobial resistance that I mentioned. Because people have been abusing the antibiotics, there have been that resistance. But the medicine that we use for typhoid hasn't been changed. It's the same medicine, but when anyone takes it and goes back to do the test, you see that there is that improvement in the condition of the person. So when it comes to resistance, herbal medicine is way better, I would say, compared to the orthodox counterpart. Yeah.
And I know that we always have the conversation about knowing if certain herbal medicine practitioners are capable as individuals. Let's say we buy products by ourselves and we don't get any herbal medicine practitioner to actually tell us what to do. When we buy these products, how do we check the quality or purity of these herbal medications by ourselves? Is there any indication that we can take or two or notice to know that this is good, this is quality, and this is the right medication for us?
So to start with, any medicine that is not labeled is out. Any medicine that doesn't have a label on it means it hasn't gone through any investigation, and it hasn't been registered, because FDA will never register a medicine that is not labeled. And when the label is on, there are certain things that you have to look at too, especially the indication on the medication. FDA is now limiting the indication, as you mentioned in your introduction, that with the treatment you hear one herbal medicine treating so many conditions. Theoretically, it's true, but then there have been regulations that FDA is trying to regularize those things so that people wouldn't go overboard. So now, mostly the indication you will see on a registered product shouldn't mostly be more than 3. And so these are some of the things that you have to look at. And also look for the FDA registration number. If the product has the FDA registration number, then you can be assured that this product has gone through tests and all that, and it's safe to use. And also, we need to adhere to the dosage on it. Gone are the days when we used to just pour herbal medicine in our mouth and swallow everything. But now, because of scientific research and all that, we've been able to know the quantity of the herbal medicine which will be able to solve the problem that you have. In the integrated centers, for instance, we have one herbal medicine that you take just 5 ml. 5 ml is just a small amount. You see this cup that we used to take orthodox medicine. 5 ml is half of it. So if you tell some people to take just 5 ml, they will feel that, hey, now herbal medicine, and I'm taking just 5 ml. But that is how herbal medicine has developed too. There have been research and all that to standardize the dosaging and all that. So we need to really adhere to the dosaging when it comes to herbal medicine, the same way that we do for the orthodox medicines too.
Dr. Prince OSEI, thank you so much for joining us this morning, our very own. And he's a big man in the herbal medicine space in Ghana. Thank you so much for joining us. And of course, when you go to the Insawam Government Hospital, the herbal medicine unit, you definitely find him there. Ask him the questions that you want to ask him.